Hi, and thanks for joining me. Most of the time when chiropractors see patients with pain in the leg, it's due to something mechanical like sciatica or hip pain or some sort of muscular pain perhaps. But I'm going to tell you about a case today which is slightly different. I thought you might be interested. Let's see our patient. He's an older man, very fit, keeps himself very healthy, does loads of exercise, and he developed pain in his thigh, on the inner aspect of the thigh, and he wondered whether he had pulled a muscle. So what I did, of course, as a chiropractor is to examine him and have a feel using my hands of the muscles and of the leg generally and see if we could find any evidence of muscular type of injury. But what I found was quite unusual. It felt like under the skin there was a bit of rope meandering its way up the thigh. It felt hard. I couldn't squish it. It was non-compressible, and I had my suspicions that he maybe had a clot in one of his veins. We have different veins, of course, in the leg. We have deep veins, and you can see in the diagram here the femoral vein. This is a deep vein, but the vein on the inner aspect of the thigh here, the great saphenous vein, is a superficial vein, and that's what I was suspicious of, was that he had some clot in the great saphenous vein. Now, when we feel the vein and feel clot in a vein, it's often the case that we underestimate the size of the clot. So it's often useful to use ultrasound to have a look at the clot and see what the extent of the clotting in the vein is. And so diagnostic ultrasound is a really helpful modality to see this. You can't see these sorts of things on x-rays, of course. So if we look at an example of this condition, you can see his we can see a great saphenous vein. It's not his ultrasound. This is an ultrasound from Radiopedia, which I get a lot of my images from for talks and so on. So this is an example. But what you can see, interestingly, is that inside the vein there is some material, sort of mixed echogenicity, white and black and grey. It looks like there isn't just free-flowing blood, which would normally look pretty much completely black on this type of picture. It looks like there's stuff inside the vein. Ditto when we do a longitudinal view of the vein, it looks like there's stuff in the vein. What would this stuff be? Well, almost certainly it's going to be thrombus. In other words, there's some clotting in the great saphenous vein. So what he's got is what's called superficial thrombophlebitis, STP, and that's why it feels hard. So when I feel it with my fingers, I can't squash it very well. When we use the ultrasound probe to try and squash it, we can't squash the vein. Veins are normally very easily compressible. A very light touch of the ultrasound probe would normally squash a vein, but in this case you're pressing with the probe and not able to squash the vein. Of course, one of the reasons for doing the ultrasound scan of this type of patient is to check that they haven't got any thrombus in the deep veins, to see whether they've got a deep venous thrombosis. You've heard of DVT. This is one of the problems that some people get after sitting on aeroplanes for long periods of time, and unfortunately it increases our vulnerability to things like pulmonary embolism. So why do people get superficial thrombophlebitis, STP, in the great saphenous vein? Well, the most common reason for that is if they've got varicose veins, which this patient has. But there are other reasons why people might also get clotting in a superficial vein. Things like genetic factors that increase their clotting tendency. You might have heard of Leiden factor 5. And people that have this sort of thing, we might choose to go down the route of seeing if their GP will get them investigated for Leiden clotting factors, because they may need to take some sort of preventative action about stopping themselves having clots in the future. The main worry about clotting of any sort is that the clots can break off, get into the deep venous system and go to the lungs and obstruct flow of blood through the lungs. This is called a pulmonary embolism. It can give chest pains, difficulty breathing, and patients die of it, sadly, who have had deep venous thrombosis. And this is the reason why we want to scan a patient like this to make sure they haven't got a DVT. My patient did not have a DVT. I could squash his femoral vein, which is the deep vein we're looking at here, quite easily, no problem, but I couldn't compress his saphenous vein. So the issues really are that if the clot is right up the higher aspect of the saphenous vein, close to where it joins into the deep venous system, and if the clot is greater than 5 centimeters in length, then we do tend to get a little bit nervous about these clots. Mostly that's not the case, and STPs can be managed quite safely with ibuprofen. You know, according to the guidelines, they don't need anything more sinister, but anything more aggressive. But if there is a worry that the clot is really high up near to the junction of the femoral vein, or if the clot is very large, then the recommendations are that the patient have some sort of anticoagulation therapy to try and reduce the incidence of pulmonary embolism. And these patients would need to have some anti-clotting, anticoagulation medication. My patient was absolutely adamant that he didn't want to have any anticoagulation medication, and he asked me if there were any foods or supplements that he could take that might help to reduce the tendency of him to have a clot, or even to break down the clot a little bit. I told him I didn't know of any particular supplements or foods that would help in this situation. There are some foods and supplements that can both magnify and diminish the effect of warfarin, which is an anticoagulant. So you'd have thought that the ones that potentiate the effect of warfarin could be used to help to reduce the clot, but the evidence is not there for it. So I'm not aware of any foods or supplements that can do this. But if you know of anything that does have an anti-coagulation effect, and there's some evidence to back that up, do send me a link to the evidence. I'll be certainly very interested to see that. Now, I have put a link down in the blog post below this video that gives you a link through to the Oxfordshire guidelines for the management of both DVT and STP, so you can link through and have a look at that if you want to. Yeah, thanks to these guys for a great article that's written back in 2015 about superficial thrombophlebitis in the British Medical Journal, my favourite journal, of course. But yeah, the point of me doing this video was just to give you the idea that not all leg pain is due to muscular injury or sciatica or joint problems. Sometimes we have problems with the blood flow as well, and that was the case with this patient. Thanks for watching. Bye for now.